to learn about the electronic fetal monitor. We're going to learn about how it works to monitor the baby and how it works to monitor the mother. For the baby, there's two ways you can monitor, externally and internally, and then we can learn all about how we can monitor the mom. We're going to start with externally monitoring the baby. To do that, we need a few pieces. We need a fetal heart rate monitor, a contraction monitor, and bands that you're just going to put the monitor pieces on with. So first you're going to explain to your patient what you're doing. You're going to pull down her blanket and pull up her gown. You're going to feel around to feel where the baby is in the belly, and that's how you're going to know where you need to put your heart rate monitor. The heart rate monitor and the contraction monitor tend to look similar. The way you can tell the difference is the heart rate monitor is flat on the underside, and the contraction monitor looks like it has a button on it. So you're going to take the heart rate monitor, has a gray tip on the end, and you're going to plug it into the gray hole. So you're going to feel again for your baby, and when you feel where the baby's back is, you're going to put your gel on your monitor piece, and then you're going to put your monitor piece on mom's belly. When you hear your baby's heartbeat, you know you're in the right place. You're going to take your band and you're going to Velcro it into place. Then after you're finished with that, you're going to do your contraction monitor. So you're going to take this one has a white tip, and you're going to plug it into the white hole. There's also another gray hole available in case you have twins. So now you don't need any gel on this one has the button. You're going to put this on the mom's fundus, which is the top of the uterus, so that we can feel every time her contraction tightens, so we know that how much she's having. You're going to Velcro this one into place. And then you're going to get mom comfortable. You're going to pull her gown back down. You can pull her blanket back up. Now, you're monitoring your baby's heart rate and your baby's contraction pattern. If the patient comes in and the doctor wants her to have an NST, which is a non-stress test, this is what it is. The only additional thing you would do is you would use this button. This is attached to the monitor, and what it is a little button that mom presses every time she feels the baby move. It makes a little mark onto the strip that's going to come out. This feeds out as you're monitoring the baby. So you would just hand this to mom, explain to her what she does with it, and she would press it when she needs it. Now, if your mom's monitoring and we can't pick her up anymore, there's some kind of issue, they need to know what's going on, the next step would be to monitor internally. There's a few different things you can monitor internally. For the baby's heart rate to monitor internally, we'll start with that. What would happen is you have this piece right here. This is called a fetal scalp electrode. This is placed by the doctor. It's put in through the vagina this way, and there's a little screw. It looks like a little spring on the end. What that does is that screws into the top of the baby's head, and it gives you a reading of the baby's heart rate. So once this is placed internally by the doctor, your job as the nurse is to hook it into the machine. What you need is you need the FSE cable, which is this, looks like a little teardrop on the end, a pigtail cable, which has two different areas, and what's called a leg plate. The leg plate is a little sticker that's stuck to the teardrop. It's just like a little button, put that in there and ready to go. So what we're going to do is you are going to plug the green button into the green hole. And then there's two ends here. One we're going to use later, but for right now we're going to use the one that says FECG. That's for the fetal monitoring. So you plug this in here. And then you take this, and this is the end that's sticking out of the patient, and you're going to apply it in here. It'll click into place. Once it's clicked into place, you're going to pull the sticker off your leg plate and you're going to stick it to the inside of her leg. At this point, you should be able to monitor your baby without having a band on the belly. The next part we're going to talk about is how to monitor the contractions internally. When you're monitoring the contractions externally, you can tell how far apart they are and how long they last. What you can't tell is how strong they are. With an internal monitor, you can tell how strong they are. This is another thing that's also placed by the doctor. And it looks like this. This end would go in through the vagina, past the baby's head, and as the uterus tightens and it feels the pressure, that's how you get the reading. This part is what comes out. Your responsibility as the nurse is how to hook this up. So how you hook this up, first you're going to take your IUPC cable, which is intrauterine pressure catheter, untangle it. And of course, as you're doing all this, you're explaining to your patient what you're doing and why you're doing it. And you're going to plug it in. For this, these would be unplugged at this point. So you're going to plug it in. This is a white tip, just like your other contraction monitor was, so you plug it into the same white hole. And what you do at this point is you're going to hit UA reference. This button over here brings your baseline to 0. We want it at 0 so that when you hook it up to the machine, you have an accurate reading. So once it's at 0, then you would come over here, and this is the part that's sticking out of her vagina, and you would plug it in until you hear a pop, like that. All this is a little sticker that goes around here and just keeps it on the mom's leg so it doesn't get pulled. And that's how you monitor contractions internally. Next thing we're going to talk about is what you can monitor on mom. So there's a lot of things to keep track of on mom, and there's a few things that we can do on here. So a few things we can do. We can do mom's blood pressure, her pulse ox, and EKG, or maternal heart rhythms. For the blood pressure, just like your regular blood pressure cuff, you have a black tip, and there's a NIBP button. Put it right into the hole. Put it on mom's arm. And you just hit the NIBP start and stop. When the monitor's on, you can set it to run every minute, 3 minutes, 5 minutes, 15 minutes, hour, 2 hours. You can set it to run whenever you need it to. You can also keep track of mom's pulse ox. To do this, you need the pulse ox wire, which is blue tipped and goes right next to the blood pressure. Plug that in. You can either have a sticker attached to it or the removable finger probe. You just take the finger probe, put it onto mom's finger, and it's keeping track of it. The third thing you can do to monitor mom is the heart rate, mom's heart rate. This is when you're going to need that pigtail again. So you're going to plug the pigtail back into the same spot it was before. And then you have your maternal heart rate monitor. Looks like this. It's like any little EKG piece you might see somewhere else. It's 3 leads. You're going to attach the green tip onto the green part of the pigtail, which says MECG. So you're going to plug that in, and then you're going to place your, explain to mom what you're doing, expose her chest, place your leads where you need them. You're going to apply them. If you're unsure of where to apply them, they even say on there, left, right arm, left arm. So you know exactly where to apply them. You apply all your leads, and now you can keep track of mom's heart rate right on the strip. That's how you can monitor externally the baby, internally the baby, and the mom. And that's how you do it on labor and delivery.